Hello, everyone, and welcome back to Senior Cat Wellness. And speaking of wellness, health and wellness, today we'll be addressing a very important topic. If you've ever wondered what feline diabetes actually is, what causes it, and how to help a cat who might have it, you've certainly come to the right place and clicked on the right video. Today, going to break down everything that you need to know, the symptoms, the causes, the treatment, and the overall basics in this beginner's guide so you can better understand this condition with confidence and, of course, support your cat in their time of need. So let's start off with the sort of the elephant in the room, the most important question. What exactly is feline diabetes? Well, in the basic terms, it's a condition where your cat's body or a cat's body can no longer properly use insulin, the hormone that helps move the sugar from the blood into the cell. So think of insulin sort of like a key. If the key doesn't work, if the key doesn't fit, sugar gets stuck in the bloodstream and the body is no longer able to use it for energy. Most cats develop a similar form of diabetes. It's similar to type 2 in humans, where the body still makes insulin, but the cells stop responding to it. And this is called insulin resistance. So what does that look like on the outside in terms of the visual that you would see if your cat does have feline diabetes? The symptoms really come in sort of the big four. You'll notice an increase in thirst. I speak often on the channel how cats are sometimes not drawn to just natural water. It has to either be moving water, flowing water, or sort of the juice and the gravy in the food. But if you notice that your cat is actually drinking a lot more, they've got increased thirst, and of course, with that thirst, they're going to the restroom a lot more often. But they're eating more, and here's sort of the catch, I guess. They're eating more, but they're losing weight. You notice that they're not able to sustain weight, even though they're not only drinking more, but eating more. And of course, they have less energy. They're just lethargic. They're about two or three steps slower than they used to be, regardless of their age. Some cats also develop hind leg weakness. Think of it this way: the cat's standing up, but the back end is sort of lowered and the legs are lowered. The only thing I can really think of off the top of my head to describe it, you don't see it much often, but depending on how old you are, I think we've all seen those little four-door sedans back in the day with going on vacation and they've got a loaded trunk and the whole rear of the car is almost touching the ground. So, of course, not to be funny, but think of that example. The hind leg weakness. They can't stand strong on those back legs anymore, so everything has a downward tilt. In addition, a dull or greasy or perhaps matted coat, the shine is gone off the coat. And if things get really bad, your cat will start to vomit a lot more, and this vomiting has nothing to do with food or hairballs. So if these symptoms or issues sound familiar, seem familiar, especially in a collective, it's certainly time to take your cat to the vet. So what causes feline diabetes? There's rarely one single reason. It's almost always a combination of situations of factors. The big one, the more obvious one, is obesity. Extra body fat reduces insulin sensitivity, and overweight felines are far more likely to develop diabetes than sort of skinny or lean and muscular cats. Another issue when you factor obesity paired with a high-carbohydrate diet, so high carbs, lots of carbs, especially dry food, especially if your cat is on a 90% to 10% dry food diet, or maybe a 100% dry food diet, because kibble, it needs starch and different fillers to hold its shape, to be that crunchy sort of individual pieces. Many brands end up being carb heavy because of it, and cats, being true carnivores, their system over time is just not built for that everyday stream of carbs. Age, that also plays a big role. Most diabetic cats are middle age or older, senior cats perhaps, around 7 to 8 years old, up till 15 to even 20. Age can naturally lead to inactivity. Genetics depends on the cat's genetic disposition, chronic inflammation of the joints, and illness, like, for example, pancreatitis. And you've got the overall mixture, unfortunately, for insulin resistance and feline diabetes. Certain medications, like long-term steroids, for example, can also lean cats or push cats, vulnerable cats, towards the development of diabetes. Overall, when it comes to the diagnosis, the good news is that diagnosing feline diabetes is rather simple and straightforward. Your vet will run a blood glucose test, check for glucose in your cat's urine, and they may also run what is known as a fructosamine test. This gives the vet a bigger picture of long-term blood sugar levels, because other conditions, unfortunately, can mimic diabetes. So proper testing is certainly key. and thankfully proper testing is available. Once your cat has been diagnosed with diabetes, the treatment usually falls in two categories, one of two. It's either insulin therapy or just basic dietary changes. Most cats will need some level of small insulin injections once or twice per day, but the needles are very tiny, and almost every it's easy to get into the routine. It's if you have diabetes yourself, it's similar to how you would handle your own personal situation. It becomes routine for you and for your cat. And the second is the diet. Vets usually will switch to that low carb diet, quite obviously. Diet that is high in protein, switching from that dry, removing that dry entirely, and switching to 100% wet food. For many cats alone, the diet itself without the insulin injections, insulin therapy will improve the blood sugar dramatically to almost a stable level. If you've just learned, say this week, that your cat's diabetic, what do you do? What do you do in the immediate, in the now? The quick way is to learn the symptoms and monitor these symptoms. The thirst I mentioned, the frequent bathroom usage, the appetite with no weight gain, and the loss or lack of energy. After that, after you know what you're looking for, even after diagnosis, those symptoms are still going to be apparent when things are sort of going on a downward tilt a bit. Follow your vet's instructions, whatever instructions they've given you when it comes to insulin, and never change that dosage on your own without contacting them first. Work with your vet to create a feeding schedule and switch foods gradually to avoid an upset stomach. You don't want a stark, immediate overnight change, but always stay in contact with your vet. Always stay in contact with your vet. Over time, your vet could recommend just little tweaks in sort of the plan to keep things on track and make sure that your cat is in good physical health and good standing. Another bit of encouraging news is that many diabetic cats, not all, but many, can go into what we would consider remission. This means no more insulin is needed, that the blood sugar is stable, and they can return to that normal life. Just, of course, there's that big caveat, with a healthier diet and healthier weight, which still means no more dry food. Early diagnosis for all of this and proper treatment, hey, these raises the chances significantly that your cat could go into remission if they have been diagnosed with diabetes. Now, untreated diabetes can lead to organ issues, dehydration, diabetic ketoacidosis, which is something you don't want to. That's very serious. You don't want to deal with it. So if your cat is experiencing or exhibiting the symptoms that I listed at the start of this video, and you're not sure what's causing them, make sure you get your cat checked out, because they could have diabetes. If you ignore these issues and diabetes is the reason for this and left untreated, bad things can happen, and we don't want to take that road. So, but with treatment, diabetic cats can live as long as typical healthy indoor cats. Live a long life, a happy life, high quality life. So it's all about getting into that routine, knowing what your cat needs specifically, and it's just a new chapter in the life, caring for your cat, and it's not something to worry about in fear. It's just part of the new life and the new routine. So if your cat's showing symptoms of they recently being diagnosed, it's manageable, it's treatable. And you, as a responsible owner, you're more than capable of handling this situation, and do so with the help and assistance of your vet, and everything should be positive moving forward. To the wonderful audience of Senior Cat Wellness, what are your thoughts on this topic? A very sensitive topic for sure, anytime we're talking about your cat's health and wellness. Is your cat diabetic? Do you have multiple cats that are diabetic? If you have a personal story to share, an important story that could help others take advantage of your knowledge, of those who've recently found themselves in the same position, please take advantage of that comment section and share with the community, especially those who have just recently found out that their cat is diabetic. This topic, it does, sometimes the topic of feline diabetes, it does seem to feel like it sort of falls through the cracks at times. So with all that I talk about, and just general within the feline community. So I'm glad I was able to address it today, and for everyone watching, everyone with a feline in this medical situation, I do hope you found this offering informative. Always glad to help. And if you found the video of service to you and to your pet, please give it a like, share it out, and subscribe to us right here at Senior Cat Wellness. Until next time, we'll talk to you later.